being here. I'm going to go ahead and do some introductions to start with. My name is Tina Knox, and I'm the coordinator of undergraduate instruction and advising in molecular and cellular biology. I am really excited to have this opportunity to provide you tonight. I'm going to introduce you to a very important man to us in MCB and one of our favorite alums. This is Dr. Richard Berkowitz. Dr. Berkowitz approached us 7 or 8 years ago. 7? Is this 7 years?
2009.
In 2009, so you guys can do that. And he was very interested in getting involved in his alma mater and giving back through a mentorship program. So we started very slowly. The first year he came and spoke, it was just him, and he took on, I think, 3 students that year and mentored them. The next year he brought some friends to talk, and we had maybe 4 or 5 mentors, and from there we have grown. This year we have 150 alumni mentors. So we are very happy to have Rich working with us, and he stays in touch with them. He sends emails out asking them to come and talk to you all and to be part of the mentorship program. So you may have all received emails from me about the mentorship program. There is an application for that. If you get roadmap, or if you check the MCB website, there should be information about that. You can apply up until tomorrow at 5 p.m. for a mentor for the next year. So fill that out and we will get in touch over the next couple of weeks. Okay? So I just wanted to introduce to you Dr. Berkowitz. He is an anesthesiologist at Community Hospital in Indiana. He is, I have to read this because it's a long title. He is the chairman and medical director for the Department of Anesthesiology, Pain, and Perioperative Medicine. He's also on the faculty at the University of Illinois College of Medicine, and he's a member of the admissions committee for Indiana University School of Medicine. So he brings a lot of expertise to us, and if you're interested, you can talk to him during one of the breakout sessions. I'm going to turn it over to Rich, and he'll tell you a little bit more about the rest of the day.
Welcome everybody. My clown tie is on, okay? Although clowns are not looked upon very highly in the newspapers and things, so I think we're going to stay away from that. Anyway, so as Tina said, we started the program back at the end of 2009, 2010. So why did we start the program? Basically, the advisors were doing a great job of getting the students through their academic courses, what they needed to take for their specific courses of study, okay? The problem was how to negotiate or navigate what was going to happen after school, all right? So I met with a group of about 10 students last week, and everybody basically, I think people look at, what do I want to do the rest of my life? And so I think we need to take a different perspective now. What do I want to do for the next phase of life? Because as you will hear tonight, everybody's taking a different course as to what they were going to do with their lives, okay? And some people have changed midstream, and that may happen to you. So don't think that the decision that you made when you leave the University of Illinois is going to be the final decision or the final career path that you have. It may change for a number. Of course, there will be a number of you that will stay exactly where you're at and stay on the course for where you want to be, but others will change, and that's okay. So you need to take advantage of the opportunities that come along. Okay, I don't want to go into too much detail about the speakers tonight because they will go into detail about their own careers, who they are, and what they're doing now. I want to thank all of them very much for making the trip to Champaign on this homecoming weekend. Okay, hopefully some of the people are staying for the football game on Saturday, despite the losing record this year. I think we're on the way up. Okay. So our first speaker I happen to know very well. Beth and I met several years ago at my hospital. She happens to be the head of pharmacy in my hospital. She's a pharmacy, started here at the University of Illinois as an undergrad. She's a wonderful person to work with, and she's going to tell you about her path to the University of Illinois.
Okay, so this is the first time I've had to summarize kind of a 10-minute code. I did start at the University of Illinois. I saw it when I was 12 years old, fell in love with college law, and decided this was the place I was going. I got here and I was pre-med because everybody wants their child to grow up to be a doctor. And I was going through my courses and I realized that I liked chemistry more than some of the other courses. I still love biology. Biology was my major. And I started volunteering at the hospital. Carl, the which has grown tremendously since then. And I started thinking about other careers inside the hospital that might appeal to me more. And started thinking about pharmacy, because up until then I always thought it was just like Walgreens, and that they build meds and they didn't get a lot of patient contact. But when I went to the hospital, I found out there was other things that you could do with it. So I finished my degree here. I applied to pharmacy school, went to pharmacy school, loved it. Decided, to my parents' dismay, to add some post-grad training on top of it before I got a real job. Did a pharmacy practice residency, PGY1 is what it's called now, in Madison, Wisconsin. And then found that the stuff that excited me the most was critical care and emergency medicine. I took a job as an emergency medicine clinical specialist at Detroit Receiving Hospital. I did that for 10 years, loved it. Started a family, decided I needed to live closer to Chicago so I could be my family. Took a job at Spectrum Health in Grand Rapids as the emergency medicine coordinator because we were starting services there. I had appointments at medical college and the colleges of pharmacy around me. And then I wanted to do more. I always wanted to share with myself. So I went into administration. I went into clinical manager for a pharmacy department, and then now it's the director of pharmacy. So that's a very long amount of time, very short amount of minutes. How did I get here? I would say that the University of Illinois, I love. I felt like I got a fantastic education. I felt that it prepared me. I would say that for the first 15 years after I graduated, I felt like I was just lucky. That I was just getting everything I wanted, and I was just such a lucky person. And then when I moved into administration and I started hiring people, I realized that it wasn't just luck, that I was prepared. I had a great resume, I had good schools behind me, and I had learned things at this school that helped me make decisions, set goals for myself to last me the rest of my life. It made me happy to be a lifelong learner, and when you're in healthcare, I don't know about other fields because I'm only in healthcare, you really have to apply a lifelong learning skill. And then also I would say that one of the best things about Illinois for me was the peer group I was part of. I didn't realize how much impact that had until much later, but there was a couple of things about the peer group here that I think really serves the students well. One, it is a competitive atmosphere. It ups your game. It teaches you that when you are, I don't know if this was your experience, but in high school it was a little bit easier for me. College was more challenging. And it taught me how I needed to change some of my strategies to become more successful and meet my goals. And it was because of people around me who were doing the exact same thing, had the same goals in mind. And it served me well. In addition to that, I don't know if this is your experience, but we would have a diverse group. So there would be education majors and science majors and art majors hanging out together. And you would learn a whole lot of different perspectives and points of view that you really wouldn't have had if you stuck just to what you did. And I think that that lended itself for me to open my mind up a little bit more, to see different perspectives and try to integrate stuff I've learned in very diverse areas into what I do as a pharmacist. As Rich mentioned, director of pharmacy is not my plan. I didn't even know pharmacy was my plan until my third year here. Pharmacy school, it was, I'm going to be a hospital pharmacist, and then after that it was, no, I'm going to be a clinical pharmacist, and I'm going to work on a unit. And then it was going to be emergency medicine, and then it was going to be emergency medicine forever. And then it was, I want to have greater scope. I want to have an activity that is constantly changing my skill set. And administration in the hospital did that for me. I think I covered all of the bits that I was supposed to do in the 10 minutes. I hope to be able to provide ideas, strategies for students at Illinois in the future. I really do think this would be a fantastic program because I kind of fell into what I liked. I think being able to talk to somebody who was already doing it or who had an idea or a history of what they have done to get to where they are, would have been very helpful.
Next speaker is from the Champaign-Urbana area. He is a urologist, and we're glad to have Dr. Eric Helfer here with us to speak to us about urology and his path through the University of Illinois.
Please cut me off in 10 minutes because I will ramble. Alrighty, so I am a graduate from 1996. I look out at you guys and it doesn't seem like that long ago for me when I was here, but hard to believe it was 20 years ago. Graduated from the University of Illinois Med School in 2000. I actually started off undergrad in business. Coming out of high school, I really didn't know what I wanted to do. And so both my parents are in business, so I just thought I'd follow in their footsteps. After the first semester, grades were good, but I just didn't like it. I knew it wasn't for me, so I talked to an advisor, and she recommended that I take an aptitude test just to see where my interests were. And I've always enjoyed science in high school, and it actually came back to become a surgeon. So I thought, yeah, I'll go pre-med, and here I am today, a urologist. Okay, so it was an aptitude test that brought me here. When I was asked to talk, one of the questions was, give some advice about your undergrad years. I'll be honest with you guys, 20 years ago, I can't remember it like it was yesterday. But there were 3 things that I learned in undergrad that I still use today. All right? You heard Elizabeth talk about lifelong learning. And when you're in the medical field, it has to happen. For example, I'm 10 years out of residency, and I'll talk about that. But tomorrow, I have a 10-year maintenance of certification test I have to take. All right, so there's always testing that's going on within the medical field. Dr. Berman will tell you about it also. Hard work, you're going to hear that every step, everything you do in life. Hard work gets, in my opinion, hard work will get you further than most likely intelligence will. Okay? And if you're willing to go above and beyond what other people are doing, that'll get you further in life also. One of the other things I remember, a professor told me early on in one of my classes. He said, Eric, after a lecture, you'll probably retain less than 40, even 30% of what I just told you. Okay? What I highly recommend you do is that after a class, sit down and review your notes for 5 or 10 minutes. That's all it takes. Then all of a sudden, your retention rate will go up close to 80 or 90%. So after that professor gave me that lecture, I scheduled classes to where I did not have back-to-back classes. So I would have a class, an hour break, a class, an hour break, maybe have a lab or something. And that's what I did. I would study 5 or 10 minutes. I'll be the first to tell you guys I was not #1 in my class in high school. I did not graduate #1 here at the University of Illinois. But with a good work ethic and smart studying habits, it got me to where I am today. All right, so after that, in med school, people always ask, why'd you choose urology? And unless you've seen a urologist, and looking through the crowd, most of you guys will see a urologist at one point in your lifetime, specifically the men out there. They're all sitting here saying yes, you'll see a urologist. Why did I choose that field? So, starting off in med school here, there was a volunteer program. I wouldn't say a volunteer program, it's called a Condit program. I know you guys are undergrads. There's a Condit program through Carl, and it allows first-year medical students to rotate through whatever specialties they want to do between their first and second year. So I knew at that point I wanted to do more of a surgical field. I didn't want to go into clinical medicine like internal medicine or pediatrics. And so I started to rotate through orthopedics, plastic surgery, trauma, general surgery, and my last rotation was urology. And if you go into the medical field, you will realize that your personality will match up with the field that you really end up doing down the road. Okay, so I rotated with a urologist for the last 2 weeks, and I still talk to that urologist today. He's very well known for bladder cancer, and so I bounce ideas off of him. Where I really chose urology was in my 4th year of med school. You get to do some elective rotations. So you guys are too young to remember ER, but everybody else here remembers the show ER. It was on right after, you guys heard of Friends? You know, you watch the reruns now. I watch Friends and I think it's a god-awful show. But 20 years ago it was kind of funny and a good show, but nowadays it's not very funny. So afterwards there was a show called ER, which was out of Cook County in Chicago. If you guys are from Chicago, you may know Cook County quite well. And so I did I did 6 weeks of trauma up at Cook County, my 4th year of medical school. And medical school then and residency when I went through it is much different than residency is now. There was no 80-hour work week limit. You remember that. And so that it was common when I was in medical school rotating through my trauma rotation, as well as being a resident, certain rotations was at least 120 hours a week. So here I am on my trauma rotation. I don't think I got sleep for a day or two, and essentially what it was put on your tennis shoes, you're going from the emergency room to the operating room, back to the emergency room, back to the operating room. And you guys have ever been in Cook County, it's an interesting experience. And so we had this young kid come in, and I can't remember exactly if he was stabbed or shot in the flank area. And so the trauma surgeon, we take him back to the operating room, we open him up. You guys, I don't know how well you guys are on your anatomy, but in the retroperitoneum, we started to see some bleeding, and it was expanding on us. So the trauma surgeon calls out to the nurse in the room and says, "Get urology in here, we need them now." It's about 3 o'clock in the morning. We're all crabby, everybody's a little bit tired. This is probably the 5th or 6th time in the last 20 hours we've been in the operating room. And so the urologist, the rest of us are required to take a call in the hospital. Also, the urologist, we hear him on the speakerphone saying, "Yeah, we'll be there in about 20 minutes. And I'm looking at my partner in medical school and said, 20 minutes? Is there a dorm room that far away? And so the urologists come in, we're all tired, we're a little bit cranky. They come in, they got a smile on their face at 3 o'clock in the morning. They're cracking jokes, they're laughing, they take a look in there and they say, you know, "Give me the knife." They open it up, it's a bad bleed. They end up taking out the kidney in about 20 minutes. The patient did fine. They look up at the crew and said, "Anything else I can help you with?" And the trauma surgeon said, "No, that'll be it." They saluted, walked out, and went back to bed. And I turned to the 4th year med student that was with me, and I said, "I'm going to do that." And here I am. So in residency, I went to University of Missouri, graduated in 2006. So urology residency is a 6-year program. Most programs now are 5 years. So my training was 2 years of general surgery, highly intensive in intensive care. So we managed our own patients in the intensive care unit. We did the ventilators and everything. I don't do that anymore, thank God. And then I did a year of research. Many urology programs still do a year of research. And then it was about 3.5 years of urology. When I was at the University of Missouri during my residency, I was on the committee for reviewing med school applicants. Okay, so I did that for 4 years. And just like most med schools, we would look at, test scores, we would look at grades. Back then, remember this was 16 years ago when I started, we really looked at letters of recommendation because that's when we got to know these applicants, who they really were. And we were when I went through the interview process, there was actually no interview. We just filled out a form and it got sent out to all the schools that you wanted to go to. But when I was on that committee, we had to do each one of us had to do about 50 interviews, and I put a lot of weight into the interviews. Just someone who was just a good person, who had good grades, but just seemed like they were doing medicine for the right reasons. But the letter of recommendation really boosted a lot of people up, because everybody had great test scores, everybody had good grades, everybody had decent letters of recommendation, but within those letters of recommendation you could read ones that were really good and then ones that were just a professor, filling something out. And so, just to give you a little insight into what I do nowadays and the continued life learning, so urologic surgery nowadays, I don't know if you guys have heard of the Da Vinci robot. If you get online and Google Da Vinci robot, you'll see 1 billion sites within 3 seconds. When I did my training, just to give you guys a little bit of background about urology, my bread and butter, I do a lot of oncology surgery, so a lot of kidney cancer, bladder cancer, prostate cancer. When I started my training in 2000, we were doing a lot of open surgery. Laparoscopy was getting started a couple of years before me, but it was mostly the general surgeons. Am I close to 10 minutes? You're good. Okay. General surgeons were doing a lot of laparoscopic gallbladders, cholecystectomy, some inguinal hernias. Urologists started to pick up on that, and we used to do kidneys laparoscopic, or we used to do kidneys open. We make big incisions, big flank incisions, big incisions like that. Anesthesia, got a little bit nervous when we made some of our really big incisions. And we would move to laparoscopic surgery, which is good surgery, but the problem with laparoscopic surgery, it's as if I gave someone chopsticks and I said, here, go operate. And it's good for someone who's got a gallbladder that's just right underneath the skin. Gynecologists were using it to take out uteruses. But with kidneys and bladders and prostates, there's a lot of dissection to get down to where we need to go. So there are very difficult angles that we had to take to get down to what we needed to do. So we were one of the first programs to actually start doing laparoscopic prostatectomies. And I had a couple senior attendings who were adamantly against it. And I had a couple new attendings who were fresh out of fellowship doing laparoscopic prostatectomies. And my senior attendings would say, why are you going to spend 7-8 hours doing a laparoscopic case when I can do it open 2.5? And so we started to do them laparoscopically. The times picked up, but it was still a long case. One of the funny stories of the attendings during one of the cases, he would walk into the room, he literally took the clock off the wall because these cases were taking a long time, and he put a calendar up there and said, you guys will be done when this hits the next month. So when I graduated from residency, I knew how to do laparoscopic prostatectomies, but I was never going to do it because it was a very difficult case. And I knew I could do it open in much less time. Now granted, the open case had a little bit more morbidity to it. Patients had to stay longer in the hospital, a longer complication rate. But where the lifelong learning came was this robotic device came around. Essentially it's laparoscopic surgery, but now it has instruments that articulate. So now all of a sudden, what I learned in residency, I had to relearn once I was out of residency, practicing on my own. So I went to classes, took courses, went to AUA courses, and here I am doing most of my cases robotically now that I did not learn in residency. So one of the best things you can learn as an undergrad, just figure out which learning style works best for you guys. Okay? If it's sitting there, rote memorization, fine. If it's something else, but just learn what works best for you, because learning doesn't stop when you leave the classroom. It actually picks up as life goes on. Alrighty, so just real quick about medicine in general. My wife is a physician also. My wife and I have 4 kids. So medicine it's very busy. 5 days a week, it's probably 12 hours a day for me. I chose urology because it's a very good mix of surgery as well as medicine. But within whatever field you guys choose in your lifetime, there's always a mix of practicing medicine or doing something else, and then a family life. So you really have to learn to manage those two. And time management is one of the best things you can do. Also, leaving high school and undergrad, I thought I had good time management down. Maybe in med school, I thought I had it down also. Residency, you have to learn time management because you only have so much time in the day, you can do so many things. But then once you get out and practice on your own, there's time management. So nowadays, been practicing for 10 years, and I'm now trying to take more of an administrative role. So I still do quite a bit of clinical practice, but starting to do more of an administrative role there in most of things also. All right, so that's my story.
Mr. John Trumbull. He is President of Sales Manager Solutions, and he's going to talk about his path with the University of Illinois.
I considered wearing my pajamas today, but I thought that wouldn't go over so well. Well, good evening. My name is John Trumbull. I'm a 1983 graduate of the Honors Biology program here at the University of Illinois. I ended up here at the University of Illinois by accident. It's a very long story. My parents actually met here, so UIUC has a deep meaning in my family. And I have nothing but pride in this institution, this university. Congratulations to you. You made a good decision. You went to a great school. You're going to a great school. I don't know how you got in, and I sure don't know how you're going to get out, but if you do, when you do, there will be 2 words associated with your name. And the conversation will go like this. Where'd you go to school? University of Illinois or Urbana-Champaign? Ah, great school. Great education. Big Ten, go Alumni. So, congratulations. You're going to hear nothing but great things about this institution when you're out. Whether it's interviewing for a job or interviewing for graduate school or med school, dental school, vet school. You guys are coming from a wonderful place. Now, how many of you have been in the laboratory and you've seen a real, live, breathing salesperson walk into your lab? Have you seen that, right? They're everywhere. The place is full of them. That salesperson typically has a bachelor's or master's degree in basic science. And there's often a second person with them. Does anyone know what that second person usually is? Their sidekick? It's either a sales manager or a field application scientist, typically a PhD or a master's. And so both the sales rep and the application specialist or application scientist are trained in science, and they're there to help you or your PI decide what products to use to try to advance their research program. And so, if you are in the mood and feel like you want to go to graduate school to get a PhD, you want to go to medical school, veterinary school, dental school, if that's your passion, go for it. We need more of you. It's a wonderful pathway. I personally entered graduate school at University of Southern California. It's actually University of Spoiled Children, but that's a whole other story. I was a graduate teaching assistant, and I decided I was frankly still pretty burned out from my undergrad. I did 3 years of research as an undergrad in the Department of Physiology and Biophysics with the late Dr. Ladd Prosser, who is widely viewed to be the grandfather of animal physiology. I had a wonderful undergraduate experience, defended a senior thesis, learned an awful lot, was very well-rounded, had a lot of extra physics and chemistry and mathematics. That was the good news. Bad news is I came out and I was pretty wiped out. 30 people entered the honors program with me. Only 11 of us made it through the program, and only 4 of us graduated on time. So it was a pretty brutal schedule. So when I got into graduate school, I decided, you know what, I don't have a PhD in me. I can't do this for 5 years. And I came back to Chicago and got into technical sales. And I've spent the last 30 years helping scientists in universities, pharma, and in biotech companies, helping them to advance their research, helping them to understand what products or services I was representing, and trying to help them make good purchasing decisions. It's often said that nothing happens until somebody sells something. And what does that mean? Basically, everything around you, the chair you're sitting in, the carpet that your feet are touching, your shoes, your shirt, everything was a purchasing decision. Somewhere somebody had to weigh cost versus benefit, return on investment. Somewhere a purchasing agent sat down with a salesperson and determined what's the best solution to this problem. So that's exactly what I was doing for 30 years. I worked for companies like Beckman, a big drug company called Roche, Pharmacy of Biotech, Amersham, which became GE Life Sciences. You probably know of Thermo Fisher and Danaher, some of the big companies that are buying everybody up right now. And those companies are filled with people like me who decided that the business of science was very interesting. And so instead of me working in one laboratory following one research path, I was able to interact with dozens or hundreds of laboratories, various types of research. I represented DNA synthesis instruments, DNA sequencing, peptide synthesis, protein sequencing, laser microdissection microscopes, software that was about $1 million a pop to buy, so I was spending a lot of time at pharma companies. And so I feel like I was well-rounded in the university, but also well-rounded in my experience. It was kind of like Mr. Toad's Wild Ride, though, because I was going through mergers and being acquired and being spun out and spun in and sold, and it was a little bit crazy. It's a very volatile industry. But if you are looking for a way to use your technical training to benefit multiple science programs, being either a sales representative or a field application scientist, or even a bench scientist at these companies, they need people to do research, to understand and develop kits and instrumentation, and develop and deliver services. It's a noble profession trying to help people solve problems. There's a bit of a stigma about salespeople. Oh, here comes a salesperson, everybody run. He's going to try to sell me a used car. But the job is actually a consulting job. You're basically learning about the product and then trying to understand the science that your particular customer is doing and finding out if there's a match. And everything that that company does is of no use until the salesperson stands in front of a scientist and debates and discusses and determines, is this product going to do what you need it to do? If it is wonderful, I will help you purchase it. If not, please don't buy it. We're both going to be miserable. So it's very much a consulting role. So it has been 30 years of mergers and being spun out and spun in. But I feel like I've had a really wonderful career. I've now become fascinated with the science of selling and of managing sales teams. So I started my own company called Sales Manager Solutions. And now I manage multiple teams for multiple companies. Some are in biotech, some are in other industries. But the grounding, the solid training that I received from the University of Illinois has prepared me for life outside of these halls, outside of these walls. And it has been a wonderful ride, and every time I come back to Champaign and see so many bright young people, I have hope for the future of this country. So I appreciate your time and your attention. Happy to answer questions later. Thank you for listening.
Is a friend. Actually, he's a contemporary of my brother's, and a very close friend of my brother's. He is a psychiatrist on the North Shore of Chicago. Dr. Jim Marks will now tell us about his path through the University of Illinois.
I also graduated in biology in '83, but I was not one of the other 3 guys in the honors program. So, sorry.
He's a psychiatrist, so he's very soft-spoken.
So I had a chance to stay here after I finished my undergrad and do my master's degree in biology, and then in my first year of medical school. So I wasn't really that interested in staying in Champaign. We went to Peoria. I was here for an extra year, but it really was a great experience. And I've heard that they're changing the medical school here, and I kind of hope they still have the opportunity for students to stay here for at least part of their medical school, if people choose to do that. Because being on a campus like this is a totally different experience than being in a big city. It's a learning experience, and this theme of lifelong learning, I mean, nothing could be more true than that. Every day you're going to get piles of journals in the mail. Every day you have more things than you could possibly read. But really that desire to learn, which all of us had when we started here at U of I, totally true, the most true thing ever. I'm lucky I don't have to take boards anymore because my class was the last year, way back then.
So your grandfather did.
Couldn't even take boards.
But he's not a grandfather.
I like to talk about the historical perspective when I'm treating my patients, because I've been in practice of psychiatry now for 25 years, which is kind of hard to believe. And I remember what it was like when I was in undergrad and medical school and first started learning about mental health and the treatments that we had for our patients, and it was quite different than what we have now. So I like to bring that historical perspective. So I did a little research on the U of I's website, and I found a bunch of pictures that will take you back to my era. I thought these were funny. I don't know if you guys are going to be laughing about that. This was during my fall of my freshman year. I'm pretty sure you had already graduated by then. I just point that out. That was the new president of the university, Eikenberry, who actually students sort of had a chance to meet and talk to on occasion back then. And We thought he was okay. We didn't really see him that much. But that was really 1979 when I was here. I kind of looked older than I thought it would. This is a picture of John Privet, who was, I think, a lawyer and maybe from the law school, and he was the chancellor of the university at that time. And I actually got to talk with him quite a few times. He was another really, really impressive guy. You see, I had a chance to walk around the union here. You see the pictures of all the graduates and the people who earned honors from the alumni. So there were a lot of smart people there, and these are people that influenced me. I mean, his career path was completely different than mine, but somebody who engendered respect, somebody who represented the university to me. And look for those people in your life. You're going to find people high up here and not so high up that I think will be important. Another person like that was Eddie Johnson, who was an amazing basketball player. You guys probably don't remember. Wasn't he the star of the team back then? And so we had time to do other things like go to the assembly hall and watch football games. I thought that was great. That was also 1979. No, that was 1983. Okay, I'm going a little far forward. This is when the team went to the Rose Bowl, which I actually attended that year during my graduate school. I mean, look at those guys. They look tiny compared to the guys on the football team. These are real pictures of my time at the university. It means a lot to me. And this was something called the card catalog. This is a picture actually from the 60s. Does anybody know what a card catalog is? This was our computer, okay? Actually, in medical school, I was looking for pictures of what they called Medline at that time, which was books with pages like, well, the telephone book, you guys probably don't know what that is either, but telephone books lined up from here to there, and that was how we did cross-referencing by hand. There was no Google, that was the search, that was how we learned. I mean, we spent a lot of hours in the library doing that, creating microfilms. That's how we did our research. I thought it was kind of fun to see. And then this was a picture of my class. There was an honor society. I really had no idea what it was, but I searched my name on the website. And you'll see in there it says James Marks. I did get some honors. I showed that to my daughter, who's a graduate of the University of Illinois. She's like, yeah, you got some honors. That's pretty good. And I even found a picture of us back then. I'm not going to point out which one was me, but it was a guy with a lot of hair. And so okay, you need that. Let's see, I'm a psychiatrist, and a lot of people don't know what a psychiatrist is, so I'm going to define it for you. A psychiatrist is a medical doctor, a physician who specializes in trying to diagnose and treat problems that people might be having with their mood, nervous problems, behavioral problems, thinking problems. It's a hard job because we don't have a machine that takes us to that diagnosis. Our practice is talking to people, listening to people, getting information from people, and from people who know those patients so we can make a diagnosis and recommend treatments. And I spend my whole day writing prescriptions for people to help them with those kinds of problems. It's pretty stressful, it's pretty scary. Talk about stigma. I mean, in psychiatry, it's not a fun thing to talk about at parties usually. It's really, really important. And when I was in medical school, I learned I wanted to be a psychiatrist because I got to work in the primary care clinic. I got to help people with their diabetes. I made house calls. I learned about surgery, though that didn't last very long. Though I do have a good story about a urologist, I can tell you that. And what I found, though, that mattered to people, to patients, when we were taking care of them, was their relationships, was their emotional well-being, was conflicts that they had in their life. And I really thought this spoke to me as somebody who had a liberal arts education. I had my biology degree, I had my master's in biology, but I also had a minor in English. I took a lot of English classes, did a lot of writing, learning to write, learning to communicate, learning to get along with people, understand people. It's really important. I think it was relevant to my practice, my decision to go into psychiatry, but also my everyday practice. Got to write a lot of letters, got to write a lot of notes, got to talk to people, take phone calls, make decisions, think. I'm kind of a salesman too. I have to sell people on the idea that it's right for them to take this medication, or to go to the hospital, or that it's okay, that it's going to be okay, they're going to feel better. There's a lot of communication skills that are required. Really, I would advise you, if I had strong advice, it would be, please take classes outside of the core of your field. You're so busy with hard scientific stuff, but take a history class, take some literature classes, take some foreign language classes, Take some business classes. That's something I didn't do that I wish I did. Learn more about your role. I think that's going to serve you pretty well. I'm also going to just finish up with a plug for we need more people in the mental health field. So if anyone's thinking about going to medical school, it seems like the number of people choosing psychiatry has dropped since the 80s when I started residency. And we need more. The statistics say that there's over a 49% lifetime risk for an adult in the U.S. to have at least one psychiatric disorder. Things like substance abuse, bipolar disorder, depression, ADHD, anxiety, etc. Mental health disorders are highly prevalent, and the medications that are prescribed for mental health disorders are among the most prescribed of all types of medications, and there's way too few of us prescribing. The amount of patients we have to see, the burden on us, the pressure on us to see more people. So if anybody's going to medical school, and then in about 4 years of medical school and 4 years of residency, they're interested in a job, call me, please. We're trying to hire at our office. There's a huge need for providers. Patients have big needs. Psychiatry is a really dynamic field. To me, it's very exciting. There's a lot that we can do. There's different practice settings, from state hospitals all the way to what I do, which is office practice. You can do psychotherapy. You can do pharmacotherapy. It's science-based, but it's really human. And coming from the College of Liberal Arts and Sciences, I think it really prepared me well for that type of career. A lot different from urology, but any career in medicine is certainly going to require that human touch, that ability to communicate, and that ability to understand other people and help them make their healthcare decisions. I could go on talking for about 45 more minutes, but I'm going to stop with that. Thanks,
Dr. Rich Byrne. He is the chairman of neurosurgery at Rush Presbyterian St. Luke's Hospital. He's going to tell us about his path through the University of Illinois.
All right. Thanks everyone for your attention. I remember this. I think it was 45-12. They lost to UCLA. That was my freshman year. 1983, I graduated 87. In 83, the football team was 9-1. We beat Michigan. We showed that Michigan thing on Halloween night, and it was crazy. And I thought that was going to happen every year. I think it's been one more than I've said that, but who's counting? Anyway, yeah, I was a biology major here from 83 to 87. At 83, I got down here. I had that year perhaps a little too much fun. I don't remember, but probably a little too much fun. Got home that summer, tail between my legs, and got a job at White Castle. Okay, so that summer I spent at White Castle, and that straightened me out. They took me to the basement at one point at White Castle, and they said, "Son, you have a bright career here at White Castle." I thought to myself, no, I don't. I felt it rise within me that no, I was going to go back and really apply myself. And by God, I did for the next 3 years. So that's why I'm standing here instead of still at White Castle. I've never been back since that summer. Anyway, I want to thank Rich and Tina and all the other speakers and all the other alumni mentors for doing what you're doing. This is entirely necessary. Those of you who are here tonight are smart to be here tonight, because there's a lot more to getting into medical school and getting good grades and getting good MCAT scores. There's a lot that goes into it. At our medical school at Rush Medical College, you're not getting in unless you've done a certain amount of volunteering hours. There's a prescribed number of hours. If you miss one, they're not going to look at your application. You have to shadow. You have to spend time maybe in a lab. You have to do some research. You have to do some volunteer, maybe some philanthropy. All of that is now necessary to get into most medical schools. If you aren't doing that, you need to get on it. That's important stuff. I didn't know any of that in 1983. I found out about 1985 because I was lucky enough to have a mentor in my fraternity, Sigma Mu fraternity, 4 blocks down. I was lucky enough to have Dr. Richard Schwartz, who was an ophthalmologist, who told me, you better get to Carl and you better spend some time in the hospital. Number one, find out if this is what you want to do. Because if it isn't, you're making a big mistake. It's a hell of a commitment to spend the next 11 years of your life in training for something you don't want to do. So get over to the hospital, make sure that you know that you want to do this. And then number two, you need to be able to show medical schools that this is, you've investigated it and this is truly what you want to do. And then you need to do some research and you should be involved in service projects and so on. I had no idea. Dr. Short showed me the way. This group can tell you that sort of thing. There's a few people here that are on the medical school admissions committee. I've interviewed for Northwestern Medical School, or I went and interviewed for Rush. I know how it goes. You need to know that stuff. I ended up going from here to Northwestern. I'll get into that in a little bit. How many people in this room are interested in surgery? Think they might want to do surgery? Fair number. How many interested in neurosurgery? There's a few here. Can I tell you something? When I was here at Illinois, 83 to 87, I didn't know it at the time, but there were 8 of us walking around campus at the same time who ended up becoming neurosurgeons. We all met later during our careers. We had no idea. One of them I could pick out of a lineup. I'd see him at camps all the time. But none of us knew each other, but there were 8 people at that time that ended up going into neurosurgery. I know a lot of neurosurgeons who went to Illinois, a ton of neurosurgeons went to Illinois. So those of you who are interested, we've got a lot of people to follow. So I went from here to Northwestern Medical School. Let's just say that the next 3 years of school went very well, MCATs went very well. Northwestern was a great experience. Northwestern had a way of making neurosurgeons too. There were 7 of us that ended up going to neurosurgery in my class. I got interested in neurosurgery because Northwestern does a thing called faculty dinners the first night of medical school, actually the night before the first day of medical school. They set you up with faculty dinners. I was set up with 2 neurosurgeons, Lenny Cerullo and Tom Brown. So many people I know, right? So very charismatic people. I was interested in the brain. They said to me over a few shots of Frangelico, I bet you maybe want to go to neurosurgery. Why don't you skip your first day of class and come to the operating room? That's right. I started medical school by going in Plainwood. I went to the operating room a lot. Fell in love with neurosurgery. I absolutely love neurosurgery. There's virtually nothing else that I can picture myself doing. Many nights a week, I dream of the surgery I'm going to do. I dream about the surgery I just did. I love neurosurgery. It's a great match. It's not for everybody, that's for sure. There's a lot of trade-offs. The lifestyle is very difficult. I was the guy grumbling when he was going home. The urologist gets to go home. The neurosurgeon's usually there for the rest of the night. The training is a lot easier now than it was, as was pointed out. I mean, the 80-hour restriction really has made training quite a bit more tolerable. The field itself of neurosurgery is diverse. There's maybe about half to 2/3 of neurosurgery is spine surgery. You might not know that, but it's spine surgery. It's herniated lumbar discs, pinched spinal cords, broken necks, broken backs, that sort of thing. I don't do any of that. My specialty practice is brain tumors. 90–85% of what I do is brain tumor surgery. I also do some surgery for epilepsy. It's wonderful. Most of the tumors that I do are benign tumors. They're not cancer. I can take them out. I can cure them. Somebody going blind is no longer blind. Somebody who's losing some other function or having seizures, they no longer have that. It is absolutely wonderful. That's the greatest thing about surgery, is that it's a very, very tangible thing. If you do something, you see the result immediately. That's what surgeons really like about surgery. The backside of that, the drawback of that, is that if it goes wrong, it's on you. And of all the tumors I did the last 2 weeks, there's one person that I hurt her vision. And you have to be ready for that too, because it's not always going to go the way you want to. Some of these are very, very complicated cases. This one flew up from Florida for surgery. We're able to save the vision of one eye, but not the other. you have to be ready for that, psychologically, emotionally, etc., because it does take a toll. But the balance is that 95% of the time you're going to help people. It's really, really satisfying. So I love this. Residency training, we've gone over that in a little bit. It's long. It's 4 years of medical school and it's 7 years of residency training. And most of my residents, I'm the chairman of the department. Most of my residents do a year of fellowship, so it's 8 years. Some do 2 years of fellowship, 9 years. Okay, so it's at least 11 years, 4 years of medical school, 7 years of subspecialty training after that. And then you're not board certified until 3 years after that. And then, as was pointed out, there's constant recertification periods every 3 years, and then every 10 years you test it. The problem is also the wonderful thing about this, and that is it's always changing. You're always learning. The neurosurgery I learned and finished when I finished my training 20 years ago. The neurosurgery then is better now today. It's better. It's constantly evolving. The technology comes in. You have to learn it. You have to learn all the new techniques. And what I trained in 25 years ago is now different. It's better, and you have to keep up. A couple of other things that you've probably picked out that a lot of the folks here are also helping to run their practices. They're leading something. Remember that that's part of what you'll do in your career in medicine or in one of the health fields, the director of pharmacy. You're going to end up managing people. You're going to end up having to handle business and business decisions. So, as it was pointed out, you really ought to be taking business classes. You should be seeking leadership positions, not just to get into medical school. It's going to help you in your career. So much of what I do, I'm in the operating room a lot, but so much of what I do is managing people. I run the practice, I'm the chairman of the department, I'm president of a couple of societies, I manage people, and you have to get used to that. I learned how to manage people, by the way, as president of Sigma Nu Fraternity in 1996. You get 80 of those people to listen to you. Hard-driven and hardcore neurosurgeons, they'll listen to you. They're self-driven people, right? But seek those leadership opportunities now. This is when you're going to learn it. You're also going to be involved in research. It's our obligation to be involved in research to push the fields forward so they don't stagnate. We need solutions for our patients that we can't help today. And you're going to be involved in education. Someday you're going to be mentors, and you're going to be involved in this program. You'll be standing up here. And I'll be retired like Dick Short. Okay, but you are going to have to mentor the next crop of residents, fellows, and medical students. Finally, I would just say that, it sounds like, oh God, it's 4 years of medical school sounds like hell. It's not. It's not. 7 years of residency. Oh my God, how could you get through all that? It's not. If you're enjoying it, if you love what you do, it's not hard. It's not work. It's fun. Just make sure you're doing what you want to do. I mean, if there's something you love, go for it. If it ain't what you love, get out, because it's a hell of a commitment to do something you don't like to do. And I can tell you, I know a lot of doctors that don't do it because they hadn't really sought out it. They didn't know what they're getting themselves into. But if it's for you, absolutely do it and enjoy the ride along the way. It's not about the title at the end. It's not about that. It's about, enjoy it all along the way. You'll enjoy your training. You'll have fun. But you will make some tough sacrifices. You're going to have to make some trade-offs. You can give up some of the hobbies that you do and so on. But it's well worth the trade-off. Certainly was for me. I think everyone else would agree. And thanks for your attention. Good luck on your journey.